BD is committed to healthcare-associated infection prevention and treatment management by enhancing compliance to guidelines, promoting standardization, and offering alternatives. Urinary catheterization is a common procedure performed both in the hospital and community setting, but carries with it the risk of serious complications. For example, catheter-associated urinary tract infection, CAUTI, bacteremia or sepsis, inflammation, urethral strictures, mechanical trauma, bladder calculi, and increased mortality. It is therefore important that prior to catheterization, the clinical need and alternative methods are considered. Urinary tract infection is the most common infection acquired as a result of healthcare, accounting for 19% of healthcare-associated infections. Between 43 and 56% of urinary tract infections are associated with a urethral catheter. It is estimated that CAUTIs increase NHS costs by £99 million per year. Factors include delayed discharge, longer patient stay, hospital readmission, increased antimicrobial treatment. The Foley tray contains the essential items required to either catheterize or recatheterize, allowing optimization of clinical practice in one handy pack. It is designed to help hospitals and primary care settings standardize practice within their own guidelines. When performing a urethral catheterization, an aseptic non-touch technique is essential to minimize the risk of infection. The Foley tray has an ANTT accreditation from the Association for Safe Aseptic Practice, confirming that the tray supports the correct technique to deliver ANTT. This video on catheterization using the Foley tray is to complement an organization's catheterization training and not intended to replace this. It is the healthcare professional's responsibility to complete their competencies as per their local policy and seek support and guidance as required. Please consult with your Nursing and Midwifery Council code. When selecting your catheter tray, it is important to select the correct type of catheter and drainage system that you require for your patient. The catheter size should be the smallest to meet your patient's needs to reduce the risk of bladder spasms, catheter bypassing, and trauma. Once you have selected the correct catheter tray, it is important to visually inspect the packaging for any imperfections prior to use. It is always helpful to retain the sticky labels on the outer pack for documentation. You can now check the labeling on the packaging. Here you will find the full list of tray contents, expiry date, size and length of catheter, lot number, and whether the catheter contains latex. In the hospital, trays contain a urine meter, bed bag, or leg bag. There is a difference in the size of packaging between the tray containing the catheter pre-connected to the urine meter compared to the leg or bed bag. In the community, only trays with a leg bag are available, with a choice of tubing length. The packaging is larger for the longer 30cm tubing. Prior to the catheterization, you must explain to the patient the procedure, the reasons for the catheterization, and the risks associated to gain valid consent. For a patient who is unable to consent, there must be a rationale for using a catheter, and it must be evident that it is in the patient's best interest. There should be multidisciplinary involvement and evidence of appropriate consultation with the next of kin if appropriate. Check your patient's identification and allergy status and offer your patient a chaperone as per your local policy. Place the tray on the bottom shelf of the trolley and attach a clinical waste bag to the side. In a community setting, place your tray on a suitable flat, clean surface. A waste bag is included within the contents of the community tray. Clean your hands with alcohol sanitizing gel or soap and water. You can now open the end of the outer plastic wrapping of the tray. There is a slot for your thumbs, indicated by the arrows, which will allow you to grip the pack. Empty the tray from the outer plastic wrapping. You may need to squeeze it out onto the top shelf of the trolley or your clean flat surface, being careful not to touch and contaminate the contents. Prepare the patient by removing the cover that is maintaining their dignity. Clean hands with alcohol sanitizing gel or soap and water. Start by opening the sterile field away from you first, followed by the sides and then the front to minimize the risk of crossing your sterile field. In the community tray, the first item is the waste bag. Place this in a suitable place away from your sterile field. There is an apron for your own protection and an underpad which should be placed beneath the patient's buttocks, ensuring the shiny side is facing downwards. Clean your hands using alcohol sanitizing gel or soap and water. Place one pair of the sterile gloves to the side to be used for inserting the catheter. Apply the other pair of gloves. Prepare your gauze for cleaning by applying the sterile water clearly labelled with yellow stickers directly onto the gauze. You are now ready to cleanse the meatus. Using a gauze swab to wrap around the penis, retract the foreskin if the patient is not circumcised. You may now start cleaning the meatus. Start at the tip, cleaning backwards. You may need to repeat this using clean gauze each time. Dispose of the swabs in the waste, careful not to contaminate your sterile field. Now prime the syringe containing the lubricating gel and apply a small amount of gel to the tip of the penis. Slowly insert the tip of the syringe into the urethral orifice and insert the gel slowly, allowing time for the gel to coat the urethra. You will now need to remove your gloves and dispose of them. Clean your hands with gel and apply the second set of sterile gloves. You can now lift the urethral catheter, which is pre-connected to the drainage bag, from the tray, ensuring that the blue catheter sleeve remains in place, covering the catheter. Unfold the bag and place between the patient's legs. Tear the end of the blue plastic catheter sleeve to reveal the tip of the catheter. Using the gauze, hold the penis upright and extended. You may now start inserting the catheter, using aseptic non-touch technique, tearing the sleeve as you go. Once urine begins to flow, insert the catheter a further 2 to 5 centimeters. Slowly inflate the balloon with the syringe containing 10 ml of sterile water. If any signs of discomfort are observed, stop and recheck the position of the catheter. Withdraw the catheter slightly until resistance is felt. Ensure that the glans penis is clean and then reposition the foreskin. When the catheter has been successfully placed, you need to secure the catheter to prevent unwanted displacement, friction, or trauma to the bladder neck and urethra. First, check your patient's skin integrity and allergy status to adhesive. If you have any concerns, do not use the StatLock Foley stabilization device that is contained in the tray and document the reasons why. Seek an alternative if available. Place the Foley catheter into the retainer on the StatLock Foley stabilization device. The directional arrow should point towards the catheter tip, and the balloon inflation arm should be next to the clamp hinge. Close the lid by placing your fingers under the pad and pressing the grip markers at the end of the clamp with your thumb. Be careful to avoid pinching the catheter. Always secure the catheter into the StatLock before applying to skin. Click before you stick. Identify the site for securement and ensure the patient's leg is fully extended. With the catheter secured in the retainer, lay the device on the front of the thigh, not the inner or outer side. Now back up 2.5 centimeters. Cleanse and degrease the securement site with alcohol, or as per local policy, let skin dry. Using the pad provided, apply skin protectant in the direction of hair growth to an area larger than the securement site. Allow to dry completely for 10 to 15 seconds. Write the date of the application on the StatLock. Align the StatLock Foley stabilization device over the securement site, leaving 2.5 centimeters of catheter slack between the insertion site and the device retainer. Make sure your patient's leg is fully extended. This will ensure there is no tension on the catheter during movement. While holding the retainer to keep the pad in place, peel away the paper backing one side at a time and place tension-free on the skin. Once the StatLock is in place, and if your patient is mobile, the leg drainage bag can be secured to the patient's leg with the straps provided. This will help support the bag to lay flat against the leg and minimise movement. Apply straps behind the tubing to prevent occluding drainage. All collection bags should be positioned below the bladder. If using a urine meter, bed bag or night bag, the bag should be attached to a floor stand or bed hanger. The drainage bag must not touch the floor. You can now remove your apron and gloves and dispose of all waste in line with your local protocol. The StatLock should be monitored daily and replaced when clinically indicated at least every 7 days and ideally on alternate legs. The StatLock stabilization device has a very strong adhesive, so it is vital that it is removed correctly. To remove the StatLock stabilization device, open the retainer by pressing the release button with your thumb, then gently lift to open. Remove the Foley catheter. To protect the integrity of the skin, it is essential to remove with alcohol pads. Wipe the edge of the adhesive pad using at least 5 to 6 alcohol pads until a corner lifts. Then continue to stroke under the surface of the pad with alcohol to dissolve the adhesive pad away from the skin.